Homelessness is one of my key local campaigns and something I've been working on consistently since being elected last year. I visited most of the relevant services in Mansfield and brought both the previous Minister for Homelessness, my honourable friend from Nuneaton, and the Home Secretary to meet with the public sector, charitable organisations and businesses to look at the various aspects of things we might do better locally. I think it's fair to acknowledge that the government has made some important steps to tackle homelessness. The recently introduced Homelessness Reduction Act is an important move in the right direction that can potentially help with the number of people becoming homeless in the first place. Through my investigations over this year, I know that it's that prevention aspect of support that's been lacking previously. The Flexible Homelessness Support Grant is also welcome in providing £250,000 to Mansfield over 3 years. In Mansfield, we have some brilliant supported housing associations, not least Framework, Nottingham Community Housing, and others that would that help get people back on their feet in times of crisis. They would love to be able to offer ongoing support to the people who rely on them, but they struggle to access the funding to do that. Now, these providers are experienced in those issues surrounding homelessness and often best placed to offer local support and tailored services. In my constituency, it's not the housing itself that's the main issue, frankly. It's the complexity of need, including mental health difficulties or addiction, that are the real challenge. Providing support in managing these things and with financial management can make all the difference. Too often the way is blocked by bureaucracy or by protectionism over different organisations' priorities and budgets. You can't get support with mental health problem if you're on drugs, but you can't get support with your addiction if you have an obvious mental health problem. The problems are quite clearly interrelated, but the services aren't. Addressing mental health issues, providing tailored local support and a joined-up approach between housing, health and local social services is key to addressing the issue of homelessness. I think most local stakeholders would agree that in Mansfield our acute services are actually pretty good. If you find yourself homeless, you have a good chance of getting accommodation and support fairly quickly, and the numbers of street homeless in Mansfield have actually fallen over recent years. And we have some really amazing local groups, charities like the Hall, Beacon Project, the Soup Kitchen that provide excellent care and support and link in with key services most importantly. What we don't have is that low-level ongoing support, the prevention service, to help people as they move on, to manage their money, maintain a tenancy, stop them ending up back on the streets. For an entrenched population of long-term homeless, this is absolutely key. It's important to note there are a significant number of people who might not feature, as my honourable friend mentioned, in the hospital statistics because they have hospital accommodation or another form of temporary accommodation. Whilst the first step, hostels can provide useful accommodation for homeless people and help to provide shelter, they're not a long-term solution. The use of drugs and alcohol, threats of violence, theft, bullying and other issues can mean actually they're not the safe space that people deserve. It's frequently acknowledged that bed blocking is a significant problem in the NHS, but there's also a form of hostel bed blocking, which is increasingly problematic, where former sleepers in hospitals are ready to move on, but there isn't that move-on accommodation or support to help them do that. A joined-up effort to look at the ways which we continue to make progress in reducing homelessness will need to involve all levels of government, NHS, social care, charities, voluntary groups. There isn't a one-size-all approach, and we have to take a whole range of approaches to dealing with this problem. I've argued over the last year that tackling homelessness needs to remain a priority and that funding levels reflect its importance, based not just on numbers, because London obviously gets a lot of cash because the numbers are incredibly high, but actually I of course argue for Mansfield, where the numbers are comparatively small, but we have a deeply entrenched population of long-term homeless who are simply not going to be able to get back on their feet without some intense long-term support. But finally, I wonder if the Minister could tell us when we're likely to have an assessment of the impact of the Act and also the success of the various trials for different services like Housing First in Manchester that have been brought forward by government. Can I also ask you if there are likely to be more proposals brought forward to look at those prevention services that I've mentioned with a view to meeting the target of eradicating homelessness by 2027?